The Queen's Nursing Institute is a registered charity that provides professional, personal and financial support to all nurses working in the community in England, Wales and Northern Ireland. This short film focuses on their homeless health initiative, which supports nurses working with people without a secure home. Many of the nurse members of the Homeless Health Initiative work alone at least some of the time and are isolated from other nurses and facilities. This film shows two services giving access to good care for homeless people and linking them to more providers, something which other services may still be aspiring to. A homeless person is 40 times less likely to have a GP. The average age at death of a person sleeping rough is 42. The Queen's Nursing Institute is focusing on improving care in this area, and with the 500 nurse members of the Homeless Health Initiative, they are working together to develop their skills and knowledge.
There's been huge development within HHI. We started off with, I think it was about 100 or so members, and now there's over 500. And I think what we need to remember is that every single member has their own experience.
There are so many different issues that homeless people face. They've got so many different health problems, and they really need a lot more healthcare support than they're getting in different areas. In Leicester they get very good healthcare, I must say, and in Bradford they've got some excellent healthcare, but in some other areas the services are very patchy, and some of the nurses are working as lone workers, so that can be very challenging for people.
I got involved with the HHI because I was actively looking for other people working in the same field as myself, and I think I responded to an email and then registered and accessed the website. We've all got this common link that we're there to improve the health of homeless people, and we do that by improving our practice, and we do that by using the resources and talking to each other and comparing practice. It's very nice to be able to talk to somebody doing a very similar job elsewhere in the country, and you can compare notes and see what's working, what isn't working.
Many homeless families are in temporary homeless accommodation. Although they are not on the streets, they will experience a lot of stresses and often have had traumatic experiences which affect their health.
What my job is, I work with people who are in temporary accommodation and who are in hostels, and I visit everybody who's either expecting a baby or who got children. When people come into temporary accommodation, their healthcare can often suffer. Usually it's because they've lost touch with health services. I ask everybody this question. Yeah. It's about smoking, and you're looking at each other. You know what I'm going to say, don't you?
She's smoking and me smoking as well, and both we want to leave the smoking as well.
Tony, good morning.
Hiya.
Hello, sorry to
right?
keep you. Yeah, fine, thank you.
They managed to get a blood sample to start off with,
Right,
and it wasn't
okay.
enough, then they wanted some more.
Right.
Then when I got down there, they hadn't had the results back. That's twice I've been to that machine.
Oh, right, okay.
And twice they had to send me back.
I've worked with this client group for 8 years now, but because I'm very familiar with them, I know a lot about common presentations, or should I say, the problems that homeless people present with in comparison to what patients present with in mainstream primary care. Most of the homeless people we see are male anyway, and sort of younger males too.
What the approach was,
more males than females, about 75–80% male.
Really?
Yeah,
That
20–25% female. But you see, of half of the females, a lot of them have children with them, and of course they go to a different service, don't they? Just relax, Tony, it's just going to go in the muscle.
Hi, Tyva, how are you?
I'm okay, how are you?
Okay, I'm fine. Because you've got a GP as well, haven't you?
Yes.
Because these are the things really I want to make sure that those things are firmly in place. So you have your health visitor here, that's going well. You've registered with a GP, that's very good. And you've now had somebody to talk to about some of the anxieties and stresses that you've experienced.
Tried and signposted me to the right people so I can get the right support that I need. So I'd say, yeah, she's been brilliant.
Come in. I like to go and fetch my patients because you can get an awful lot of information before they sit down, before they even open their mouths in the consulting room.
I'm going next wave now.
Yes, that was very sad.
Expect to see you today. Shall I sit over here? Then tell me about your house, because the last time I saw you, you were homeless, weren't you, at that stage?
Yeah, I've got my house now, 2-bedroom. You should come and see it, really. It's
I will.
Really nice.
I would like to come and see it.
Nice carpets, nice laminate, my own choice at last.
At last, yes.
Yeah. I'd really love to say thank you. I found this opportunity to say thank you so much. I don't know what I would have done without you. The way you supported me when I was really low, you took your time to talk to me and listen to me. The letter you wrote to the council, just being there. Thank you so much.
Oh.
I also do a lot of visiting out, so I'll go out with other team members from other agencies like the City Council outreach team and see people on the street. I visit patients in hostels, I'll go and see them in hospital. I liaise with other partner agencies, statutory, non-statutory, council, YMCA are probably the two biggest ones.
And we did immunise a family of 7 here not that long ago.
What did you immunise them against?
Oh, all the usual childhood vaccinations. I think they'd come from another country, so we go through a process of working out what we know that they've definitely had in the country that they've come from, and then she matches it all out and gets a schedule before we do all of that work before we go out. So we do it in stages because it can be quite complicated.
The Homeless Health Initiative has resulted in many case studies to document achievements.
There's a lady who works with street drinkers and she wanted to be giving them thiamine injections, which is something that's often given to drinkers, as a preventative measure, but she wanted to understand about doing this with homeless people. And she put a question to our members, and various people answered this question and gave us some advice about what they did locally. And she said that this gave her the confidence to start changing her practice, which improved the nutrition and well-being of some of the most vulnerable clients. This one I really like. It's about a gentleman who's called Joe. He lost his job in a particular city in 2008, and unfortunately a couple of weeks later he became homeless and ended up with all he had was the clothes he stood in. The homeless health services there found him sleeping out when it was -1 degree centigrade. And he'd not even told his family about his situation, so it was a very difficult time for him. And through working with the Homeless Health Service, he'd managed to get into local housing services. After he'd been housed, they decided to ask him to be involved in service user involvement, which is a way of patients, service users giving their views on a service and improving it. What I'm hoping that people will have noticed is the difficulties that nurses face trying to support homeless people and the genuine difficulties faced by homeless people.
Personally, I've attended some of the network meetings, met other people, and I also use the resources online, which is very good because everything's done for you there. You can look up, the references are there. You can look up sort of particular things that you're interested in. I'd seen a presentation on child protection, and every now and again I've got that presentation that somebody else did, and I will refer to it and use the references. It's very useful, and now of course there's the online forum which I'll be able to use.
I think there's lots of opportunities for nurses working within homelessness, and I think if you look up and down the country and you see such diversity, but there's always, if that is the case, there is always room for revising your services, making sure that they're still fit for purpose and looking for opportunities. And what I'd say to nurses is be brave. You're the best people to know what the needs of your service users are. You talk to them on a day-to-day basis, ask their opinions, what's good, what's not so good, and what could be changed. Then find out who your friends are, find out who cares about what you do and cares about homeless people.
But I think nurses need to be supported as well, because it's impossible to do your job if you're feeling stressed and under pressure and don't have the resources in the terms of information to do your job.
Nurses can sometimes feel quite disempowered and feel that they have very little voice, particularly if they work on the front line, and maybe they can feel that they have no say, but in fact the patients need them, they need them, they are the voice for the patients.
I'm really pleased I joined the HHI and will continue to be a member.
There are lots of resources on the Q&I's website that will help nurses improve care. For more information, visit qni.org.uk and click on Homeless Health Initiative.